Aging is a part of life and something that should be looked forward to. And for women, part of the big change they have to go through in their 40s or their 50s is menopause. In this episode, we'll better understand this natural biological process and what lies beyond menopause. I'm Dr. Freddy Gomez, and welcome to MedTalk Health Talk on CNN Philippines. Let's welcome our guests who will empower us with better understanding on menopause and what women really go through during this natural bodily process. With us is Dr. Angela Aguilar. She's an OB-gynecologist from the Medical City and a faculty of the Division of Reproductive Endocrinology and Infertility at the UPPGH, as well as the past president of the Philippine Society for Reproductive Medicine. We also have Dr. Eileen Cynthia De Lara, who is a cardiologist from the University of Santo Tomas Hospital. Thank you both for joining us on this program. Now, Dr. Angela, let's get straight to the topic. Please describe for our viewers what menopause is.
It's very important that we make sure that the women who are going through this phase, they're able to define what menopause means. Menopause is the cessation of menstruation for about a year. It's not yet over if you have intermittent menstruations or periods that occur infrequently. You have to wait for a year before that event occurs. That said, menopause can be a big transition for many women, lasting in a period of 1 to 2 years prior to the last period and extending 1 to 2 years after the final menstrual period. So the transition is called perimenopause, and the symptoms are found or usually experienced during that time.
So in this episode, we'll be talking about the physical changes, but I'd also like to touch on, Dr. Eileen, some of the sociological, maybe even psychological dimensions to it, because there's a lot of connotations maybe attached to the word menopause. Could you talk a little bit about how menopause, in that respect, it is a natural process, but it also affects a lot of the person's social surroundings, the relationships, most especially their self-esteem?
When you talk about menopause, women actually can't really detect whether this is really menopause or they have cardiac condition, no? Because majority of women, no, presenting with symptoms of menopause can also mimic symptoms of cardiovascular disease. That's why it's very important really to educate them about this period, no, of not actually menopause itself, but the perimenopausal period. And that is when all of these manifestations of symptoms starts to happen. One perfect example is what is known as the vasomotor symptoms. No? So when you talk about that, it is basically same symptoms that patients with cardiovascular disease would probably complain. They have palpitations and they always think that it's cardiovascular, not actually thinking that may be part and parcel of their perimenopausal period. So other symptoms such as, easy fatigability, the easily sweat, sleep disturbances, these are very, very common symptoms that women would actually complain. And if you don't talk about menopause in that particular line, they might mistake it as, a cardiovascular disease. And most often than not, these patients will really come to a cardiologist, not to an OB. So I think that's a very important impact, in the lives of women when you talk about menopause.
I think that's a very important point you put up there, Dr. Eileen, because it's the identification of these symptoms that is best for that person undergoing this journey. Now, with that being said, Dr. Angela, let's talk about the start, because there are 3 phases of menopause. But before we discuss that, what we want to be able to give information is for that woman to identify that she is undergoing this. Before that though, is there an age? Is there a hard and fast rule? At this age, magkakaroon ka na ng first stage of perimenopause?
Changes in menopause, the symptoms can occur 1 to 2 years before the actual cessation of her periods. And that is why, because the woman is not aware that these are attached to menopause, they really attribute it to a cardiovascular pathology or a condition. And they only see us when their periods completely stops or it becomes irregular. Now, when do these changes occur? Nowadays, we do see women in their 50, 51, 52, only by then are they experiencing these menopausal symptoms and changes.
Now, let's go to the different stages and let's start with the perimenopause symptoms. A lot of these are pretty significant. Trouble sleeping, mood changes, weight gain, dry skin, hair loss, changes in body temperature, irregular periods. On paper, all of these symptoms happening to any person would make them feel overwhelmed at what they're feeling. Do all of these symptoms happen all at once, Dr. Angela, or do we see a gradual progression?
A different experience for one woman to another. And earlier changes would mean that the patient would experience the vasomotor symptoms, as Dr. Aline had placed. The hot flashes are one of the more important symptoms that should be recognized early. Number two, the irregularities in periods happen in the middle of the transition. And the last of these changes are the urogenital symptoms, the vaginal dryness, and they will have sometimes urinary symptoms like dribbling or painful urination, even painful intercourse or sexual intercourse.
Dr. Eileen, you mentioned earlier there's some significant amount of women who may think they have one condition when it is menopause. What are some of the conditions that can be mistaken for perimenopausal symptoms?
All right. So as a cardiologist, most of patients coming in with palpitation would always think that they have a cardiovascular condition. One may be a valvular heart condition, coronary artery disease, along with, of course, some endocrinology conditions. Thyroid is one of the most common associated disease, no, with palpitation, easy fatigability, or they easily get tired, as part and parcel of the differential diagnosis that you have to consider, no, in a patient or in a woman presenting with all of these symptoms. So they really don't know what's wrong with them, and they ended up going to a cardiologist who would initially diagnose them as somebody who has a heart condition. So lalo sila nagkakaroon ng sleep disturbances, no? But actually, it's a way, no, at this particular time that we have to inform our audience, especially the women, that in that particular age, it is not always cardiovascular disease, no? We have to think of perimenopause as a stage, no, that they are really going through.
When we return, we'll take a closer look at the stigma and misconceptions that are often linked with menopause. We're your connection to better health. This is MedTalk Health Talk. I'm Dr. Freddy Gomez, and welcome back to MedTalk Health Talk, where caring is our calling. Dr. Angela, you mentioned earlier how women nowadays are undergoing menopause at a later age, sometimes in their 50s. Now, do you see an increase in unplanned pregnancies where the woman is becoming fertile or is still fertile or getting pregnant in their late 40s or even early 50s?
Certainly, every woman who is still ovulating have a chance at getting pregnant. And that is a concern because one, whether she wants to still be fertile or wants to add or start a family at that age needs to be evaluated because we are not as fertile at that age because one, our ovulation may come far and few in between. Number two, the quality of our eggs at that stage will not be likely to result in a live birth. So if we want to avoid pregnancy that is unexpected, certainly we have to be aware that we still have a risk or a chance at getting pregnant.
For those who do want to have a baby in their late 40s or even early 50s, what are some advice that you can give them? Is this something that is possible for them? Is this healthy for them?
Well, it's very difficult to get pregnant after the age of 40, but we do have evaluation of these women. We check for their anti-Mullerian hormone to check for ovarian reserve, and that will give us a very accurate prognosis as to their chance of conceiving. On the other hand, you're talking about whether is it safe for them, and that will really depend on how healthy they are. And that is where we collaborate with our colleagues like Dr. Eileen, cardiovascular specialist, because this is a quite neglected aspect for women. They may be very busy focusing on their careers, but they neglect their health risks. And this has to be evaluated to be able to assess whether the woman is healthy enough to carry a pregnancy to term.
Definitely. So, reminder to our viewers, if you have any questions with regards to your plans for the future of having a family or whatnot, it's always good to have a healthy talk with your OB, gynecologist, with your internist, even with your cardiologist. Now, Dr. Eileen, I'd like to ask, a lot of women, this is an important topic, but it seems it doesn't get talked about enough, even amongst women. So my question for you is, what seems to drive that stigma on women not being so comfortable with the thought of them approaching menopause?
Of course, when you talk about menopause, women would always think that I'm nearing a chronic disease. That's why they sometimes try to put it on the side, not think about it. No? But I guess what we have to do right now is really embrace that this is a stage in a woman's life that would really come and eventually will pass. And it's really our responsibility to take care of it, no? Eventually preventing, no? All of these chronic diseases to set in. No? That's why it's very important that we really have to encourage women who are already in the perimenopause, also in menopause, to check with an internist or a cardiologist to make sure, no, that all of these risk factors will be addressed early on.
That being said, Dr. Eileen, let's touch on the complications once a woman reaches that stage of menopause. Let's start first with hypertension. Please talk about this a little bit more. How can they manage this effectively? When can they expect all these changes to be significant?
All right. So when you talk about menopause, of course, there is a hormone there, no, that somehow serves as a protective hormone for women against these chronic diseases. But once you develop menopause, no, you have now withdrawal of these hormones. These are your estrogen and progesterone, which somehow helps a woman, no, against all of these chronic diseases. Of course, early on, as I've said, we really have to encourage all of these women to have a healthy lifestyle. No? Start early. Because most often than not, no, women actually forget all of these things because they think they are still not on that vulnerable stage, no, in their life. But of course, when you have in this stage of peri and then eventually menopause, you are now starting to go to this very vulnerable stage. No? That's why early on, do your lifestyle modification.
Now, Dr. Angela, let's talk about weight gain. This is one of the issues which a lot of women think are inevitable. Can you talk a little bit about the reason for the weight gain? And is there still a way to manage or still be at that ideal healthy weight?
Thank you for that. Interestingly, this generation that's entering their 40s and even their 50s and going into menopause are by far healthier than women 10, 20 years ago. Many women are now very aware of their health and are aware about their lifestyle. But that said, long-term impact on poor diet and poor physical activity will take its toll. But we really have to make sure that when we enter this phase, our long-term lifestyle will be good enough so that we can minimize the impact of hormone withdrawal in this phase so that medically or physically we are healthy and able to cope with the changes that we are facing with menopause.
When we return, we'll provide some tips on how you can be ready for menopause. We'll be right back on Med Talk Health Talk. I'm Dr. Freddy Gomez, and this is Med Talk Health Talk, your partner in healthcare. While menopause is part of the journey for many women, some lifestyle choices can be triggers for menopause. For example, if a woman is a frequent chronic smoker, they are more likely to experience menopause earlier than a woman who doesn't smoke at all. So as a result, some women can actually experience menopause at an earlier age. Dr. Angela, let's talk about that. Can you share some insights on this notion, how certain lifestyles can affect the occurrence of menopause?
menopause is actually dictated by genetics. So, how old your mother had her menopause will likely be the age that you will enter menopause as well. But that said, smoking makes you have an earlier menopause, and chronic smoking puts you at particular risk.
Now, Dr. Eileen, my question for you is how does alcohol intake affect perimenopause or menopause?
Generally speaking, no, there is not much study looking at direct association of alcohol with menopause. No, with regards to cardiovascular disease, of course, it's not only again looking at its direct effect, but concomitant with smoking, concomitant with obesity, diabetes, and hypertension. All of these things are all triggers, no, for the development of atherosclerosis. So it's not just hypertension alone, but the atherosclerosis process.
Now, Dr. Eileen, a lot of women may feel anxious or even depressed once they reach that phase that they are approaching menopause, which is entirely normal. But what advice can you give to those who may fall into that stage and may have difficulty trying to cope with it?
I think the most important advice I would give them is probably embrace, no, that this is part and parcel of a woman's journey. No? So it's better to have someone, no, to really confirm what you are experiencing. So, and that would be, consulting with your physician.
Okay. Now, menopause may feel uncomfortable for a lot of women, but that doesn't mean it has to be an unpleasant experience. Dr. Angela, what kind of advice can you give in order for women to prepare for changes linked to menopause?
Dr. Eileen put it beautifully, the word embrace, because insight is helpful in making you less alarmed at the symptoms. So when you're prepared, you understand what's happening to your body and you're able to manage and be aware of the changes it's undergoing, number one. Number two, make sure your diet and lifestyle will put you in a healthy baseline, because menopause plus if you're in poor health certainly adds up and makes the experience very difficult for a woman trying to cope with all these changes. Last but not the least, when you have these changes, you really have to remember us, your physician, because there are annual available methods that we can do to check your health. You need a health check at this point. So all of these help us prepare, manage, cope, and minimize the impact of menopause on our health and as well as our lifestyle.
Dr. Angela, are there support groups for those who are going through menopause? Is this something that could help ease that load, ease that anxiety for one thing, being together with people who are undergoing the same journey?
Well, in hospitals, there are menopause clinics and they organize many activities that will help women cope with this menopause, educate these women, provide medical care to these women, and provide socialization for these women, because peer affirmation and support is really very helpful.
Now, Dr. Eileen, in terms of the heart again, a lot of women may be wondering, are there some things that are absolutely better that they shrug off altogether? Things like we talked about smoking, we talked about alcohol. What about caffeine? Is caffeine something that should be limited once someone undergoes menopause?
Definitely, we all know that caffeine, excessive caffeine, will actually mimic palpitation as what we see in patients who are in their perimenopause and eventually into menopause. So that's one thing that we really have to advise our patient to lessen their caffeine intake. No, not just caffeine, but food that are rich with caffeine, like for example, chocolates, sodas, no. So they have some form of components of caffeine, and that could add up, no, to the symptom of your vasomotor symptoms, as what you see in patients with perimenopause and eventually menopause.
I hope our viewers gained a lot of advice from the two of you. But before we go, of course, we are going to give them even more advice. Any final words? I'll start with Dr. Eileen.
For women, of course, this is not only for women, but all of us, make sure that we have a healthy lifestyle early on in our lives. No? As what we have been discussing, eventually it will create a big impact in that particular phase that we're going through, and that is perimenopause. So start with a healthy diet, start moving around, have yourself checked.
Yes, definitely. And Dr. Angela, final words from you.
Arm ourselves with knowledge. Better knowledge will help us cope with the changes our body will have. Access health care. Don't be afraid. Don't wait until the last moment when you have really bad symptoms, because preventive medicine is best. And to prevent that, we need to have better advice, fit a lifestyle, and a healthy diet to cope with it.
And with that, thank you very much, Dr. Angela Aguilar and Dr. Aileen Cynthia De Lara, for being with us today and sharing your knowledge on menopause. I'm Dr. Freddy Gomez, and thank you for watching Med Talk Health Talk. We'll see you again next time.